Hello, 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 YouTube world. So excited to be joining you today. It is Thursday. I'm just getting my screen set up here so I can see your chats. Today is Thursday, the 26th of May. I'm so happy to have you join me. When you come in, just give me a quick wave or a thumbs up or a hi and let me know that you're here. As always, I'm here every Thursday at 3 on my YouTube channel live to answer your questions on CNA training, testing, workplace issues, or whatever else you have on your mind that you want to talk about today. Hi, Jennifer. Thanks for joining. So lots going on in the world, of course. And Monday is Memorial Day. So I have my Memorial Day shirt on. And I would like to thank all of the people that went before us and gave their lives in order for us to have freedom. So I do want to acknowledge that and solemn heartfelt empathy for all the families of lost soldiers as we lift you guys up this Memorial Day as well. So good afternoon, Monique, and hi, Mashine. Nice to see you. Oh, thank you, Jennifer. Jennifer says, I always look forward to this. I'm glad I work evenings so I can watch. We're so glad that you're able to make it. I've thought about kind of moving this to a different time. I mean, everybody has different schedules, so it's really hard to find a time that meets everybody's needs. So right now I'm going to keep it at 3 on Thursdays, but if you guys have another option, if you have a suggestion, make sure you send me a note through my website foryourcna.com and under the contact us, and I'll be happy to take it into consideration. I am willing to kind of move this to meet your needs because after all it's all about you guys. So those of you that are tuning in after this airs, yeah, a lot of people work during the day, Jennifer, I agree. So those of you that are watching this after hours, after it airs, after I'm no longer live, make sure you kind of let me know. Either leave a message in the the comment section of this video or head over to my website. Either way, and I'll kind of look at maybe changing this to a more convenient time for everybody. It's so hard to kind of figure out what's going to work best. But today we're here at 3 on Thursday. So let's get started. As usual, hi, Jazzy. Hi, B. Hi, Denise. Thanks for joining. Hello, servant of Christ. So today I want to kind of talk about a topic that Mashine brought up last week and asked about that I didn't have time to get to. And I said that I would focus on that today. And that is hospice. So hospice is one of those types of nursing that a lot of people shy away from because they're afraid of it. And I think that if we kind of take some of the mystery out of it, you would be able to see whether this is a good fit for you or not. So give me 1 second here. I got to take a drink. I'm losing my voice already. Pollen level super high. I'm here in Florida. Everything is yellow and it makes my throat dry. So I got to drink a little bit. All right, guys. So let's talk about hospice. A lot of people are afraid of death and dying. I mean, our culture, for some reason, has death and dying as kind of a taboo subject. Nobody likes to talk about it. Nobody likes to think about it. Nobody likes to work with people that are dying. It's kind of a scary thing. And I think that horror movies really have played into this and reinforced this belief that death is scary. Death is the one thing in life that you are guaranteed to experience. Guaranteed. Guaranteed. Every person on this planet will face death, period. There's no other way out of this, right? So you may get out of paying taxes. You may get out of going to school. You may get out of working for a living. You may get out of a lot of other things, but death is the one thing that's guaranteed to come knocking on your door at some point in your life. And I think because of that, it's very frightening for people. And when you're talking about working with hospice patients, you have to face that. You have to face your own mortality when you're working with dying individuals and their families. And I think that this is just a place that most people aren't willing to go mentally. So I want to kind of talk about that aspect of it, and then I'm going to get into the care that we provide for the the dying and their families. So when we're looking at our own belief systems with death and dying, there's a couple things that I want to expel right off the bat. First of all, dead people do not sit up. They don't do any of the crazy stuff that you've seen on horror movies. When you pass away from natural causes or trauma, when the body actually dies, everything just relaxes. So if there's lungs in your body that have a little bit of air, that air, because the lungs and the diaphragm and the chest muscles are all relaxing, right? Whatever's it left in your lungs is going to seep out. So you may hear a little bit of a right, because that's the air leaving the body. Your urinary sphincter, the valve at the bottom of your bladder that holds the bladder shut, that will relax, right? Because every muscle in the body just lets go. So that will naturally open. And then whatever urine is inside the bladder may come out. Same thing with the anal sphincter at the base of the rectum, what holds your feces in, right? That's going to relax. So if there's anything in the bowel system, it's going to seep out because we don't have that muscle tension to hold it closed anymore. But that's pretty much what happens to the body when dying occurs. Everything just relaxes, right? Now, I know you've seen movies where people like stiffen up, right? When they die. That's actually called rigor mortis, and that doesn't set in until hours after the dying process. And what happens, I'm going to give you a very scientific explanation here. What happens is inside every single cell you have, particularly your muscle cells, you have lactic acid. And as that lactic acid leaches out of the cells, because remember, everything in the body relaxes, including your cell membranes. So as that cell membrane starts to relax because it's not getting fed and it starts to break down, that lactic acid leaches out into the muscles, and the muscles will stiffen up because of that buildup of lactic acid. After a while, that lactic acid just naturally decomposes and um, dissipates and breaks down into other compounds, and then the muscles relax again. So you go from pliant, right, or able to be moved for several hours after death, to stiff, to relaxed again. So when you're working with dying patients, everybody kind of, or a lot of people, not everybody, a lot of people kind of expect, oh my gosh, they're dead. They're going to be stiff. I can't wash them. It's going to feel weird. If you're washing a body that just passed away within the last hour or so, that body is going to feel very much like it did before it passed away. It's not going to turn cold all of a sudden. It's not going to become stiff all of a sudden. And other than just the absence of breathing, you probably wouldn't even know, right? There's no big neon sign that says, hey, this is a dead body. You probably wouldn't even know that the patient had passed, because a lot of those things that we kind of have picked up through movies and books and things like that, they're not altogether factual, and you don't have that that remember that those things, the books and the movies, are trying to elicit an emotional reaction from you, right? It's not necessarily based in science. So performing post-mortem care, a lot of people are like freaked out about that. Oh my gosh, I don't want to touch a dead body. I don't know what to do. It's going to be creepy and weird and whatever, scary. And it's not. In fact, this is probably one of the most deeply spiritual activities that you can do as a caregiver in any capacity, whether you're a nurse, a CNA, a caregiver, a family member, or whatever, is to bathe the patient and get them ready to send off into the afterlife. It is a very spiritual um, act that you can perform. And you have to do it with the right amount of respect and dignity and care and concern and just reverence. Okay. This is the last time that anyone will be able to clean this patient, to prepare them for their family to come say their goodbyes. So, this really needs to be done with the right mindset. So it's not for everybody, certainly, but it's not to be feared either. Like I said, washing the body, the actual act of washing the body is no different whether the patient is alive or passed. The actions are the same. The patient's going to feel the same. There's no big change that happens. But you also have your reaction that you have to work around, right? Because this patient has passed. And if you aren't prepared for that, it can affect you. Um, so I was a hospice case manager for 5 years. I have cared for a lot of patients that passed over, and I really felt very, very strongly that it was my job to make that passing as close to perfect for the patient as possible, for their ideals. What do they want? What is, do they want their family at the bedside? Do they want um clergy to come in? I mean, what is it? This is the final act that the patient gets to participate in. So we really have to keep that in mind. I preach a lot that it's not about us, it's always about the patient. You guys have heard me say that, right? That everything we do has to be about the patient, not us. But there is one segment of healthcare that is much more important than any other, and that is when you're caring for the dying patient. Because if we aren't willing to accept their direction, then right at the very end of their life, this is the last time they get to tell us what to do with their body, then we really should not be in healthcare. Does that make sense? I hope that makes sense. But you really do have to kind of go through some internal checks to figure out whether this is something for you. Now, why I liked hospice is because it was the last form of nursing that encouraged you to spend time with the families and the patient. So every other part of nursing right now is so busy, 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 busy. You've got 12 patients, you've got 4 baths, you've got feeding, you got all these things to do. You have to coordinate with this person and that person, and you just have so much to do, so much going on, that to have a conversation with a patient, that's almost laughable. You don't have time for that. So hospice is the last part of healthcare that understands that caring for patients has to be mind and body. And we encourage our healthcare workers to spend that time to talk with the patients, to let them voice their fears and concerns, and to reminisce about their life. And it makes the transition, the actual dying process, much, much, much easier. So if you feel like you would like to help patients in these final days and hours of their life, and you're helping, you want to help families accept this inevitability, and you want to be able to help, just to give them that emotional support that they need, then hospice might be a very, very good avenue for you. Now, what a lot of people think, though, is that hospice is a place people go to. And that's not true. Hospice is not a place, it's a philosophy. Okay, very important. Hospice is not a place, it's a philosophy. So, hospice tends to patients wherever they are. So, we can have patients in a home that have hospice come in and help them. We can have patients in an assisted living facility or a nursing home or even a hospital that have hospice caregivers come in and help them. But we can also see patients in jails or in rehabs, or, well, rehab probably not, but in other settings outside of those traditional ones that I just mentioned. Now, someone just asked, Mashane says, just confusing of the care work continue to give them once the resident is placed in hospice. So that's exactly where I was going. Great job. So that patient, let's say we have a patient, let's call her Mary. She is in a nursing home. She's already got staff around her that's used to her and takes care of Mary on a daily basis. But hospice is asked to come in. Now remember, hospice is there to attend to the patient and the families as well. But hospice is asked to come in. So now the CNA at the facility is like, well, wait a minute. What am I supposed to do with her? What is hospice doing? What am I doing? You do exactly what you've been doing all along. That level of care doesn't change. You're going to follow the care plan. That hospice caregiver is going to come in and provide an extra level of care for this dying patient. So it may be focused on back rubs and just trying to get the patient out of pain. It may be extra bathing because the patient is sweating a lot. It may be just a comforting hand to hold and somebody to reminisce to. That caregiver, that hospice caregiver, is going to add an extra layer of care on top of what's already being provided. So hospice should not be, in most cases, be taking over the day-to-day care. You're still going to follow the care plan for that patient. It's going to be added in addition to. So home care, if you have a family member that's taking care of a patient in a home, in their own home, then hospice would come in and add an additional layer of care. Now, hospice can stretch beyond that. Hospice can provide 24-hour around the clock bedside care. That is something that hospice can do. But if we're already in a nursing facility where there's already 24-hour care provided, generally speaking, hospice isn't going to put 24-hour care in there, but we might in a home care setting if the family's ill-equipped to deal with the the actual dying process if the patient has a lot of needs. Now, one of the things that we need to understand is that hospice does not actively speed up the dying process. That's not what hospice does. So a lot of people know euthanasia, right? That's not what hospice does. Hospice is there to provide palliative care. Now, palliative care means that we're focused on the symptoms. We desperately want to control those symptoms. So if the patient is breathing better, if they're out of pain, if they're resting comfortably, then and they're not struggling, then the dying process becomes easier. Now, sometimes this can get really confusing though, because when we get the patient out of pain, sometimes they're able to relax and then the dying process happens because they're not so, focused on the pain. They're not so stiff and so overcome with their symptoms. So sometimes it may seem like they passed away a little quicker than you expected, but it's not because hospice care hastened the death. What they did was provide comfort for the patient, and sometimes just relieving those symptoms, the patient relaxes and then the death event does happen. But this is where nurses are supposed to step in and explain to the families what's going on with the patient, what the expected timeline is, what some symptoms the patient may experience, so that if the families are well informed, if they understand what's happening, if it's not this big question mark out there and they're not hyper vigilant watching the patient and because they don't know what to look for, when they understand what's expected, the families also can relax a little bit and allow this natural phenomenon to happen. But we have to support the families as well because there's going to be a huge loss and they're going to be grieving, and we have to understand the grieving process as well. So, couple of things just to sum up. First of all, hospice requires a very special type of caregiver, one that can confront their own belief system of death and dying and can provide compassionate care. We have to understand what types of tasks we're going to be doing, that we're adding an extra layer of care on top of what the patient is already receiving. And that hospice involves not just the care of the patient, but the family as well. And that hospice is provided wherever the patient is. Now, there are hospice facilities. If the patient isn't comfortable in their own home, if they don't have a caregiver to help them, if there's a lot of, you guys have all seen this, I'm sure, families that just don't get along at all, and it's a very chaotic, tumultuous location, then the patient may be eligible to go to a hospice facility where we provide round the clock hospice care by trained hospice workers. But that's pretty rare overall. Most of the time, we try to keep the patient where they are because that's where they're most comfortable. I hope that helps, guys. If you're considering hospice, something you can do is go onto my website. I have a personality quiz on there. If you take that personality quiz, and it's free, but if you take that personality quiz, it goes through 19 questions that ask you things about your personality, right? The things you like, the things you don't like, the things that you would find interesting, the things that don't appeal to you. And it compiles all that information. There's a lot of psychology in this. Compiles all that information and then tells you the best setting for you. And hospice is one of those settings. And then it'll give you a huge report about what hospice workers do, where they work, the type of care they provide. All of that is there for you. So go take the personality quiz. You might find it very, very interesting. And then I also have all the other options that you can read through as well. So let's see what everybody has to say. Yeah, Jennifer, you're right. I guess I could just watch the reruns, but I couldn't ask questions. And that's true. That's kind of one of the downfalls of watching the reruns of my show. Let's see here. Noe says, good afternoon, Miss Patty. I'm going to take the exam. I'm just scared because my English is not enough for the written test. Tell me something, please. Oh, that's a really hard one because I can't fix language deficits, unfortunately. There's not much I can do about that other than to just tell you to take your time and do the best that you can. The more English you listen to, the better you'll understand it. I know I'm learning a second language right now, and it is hard. It is really hard to learn a second language. I really wish that I could help you with that, but I don't know how. Moses says, hi, I'm new here. Just joined my classes last week. Oh, exciting, Moses. Thank you and welcome. Ollie, hi. Caleb says, hello, Miss Patty. I've been watching your CNA skills videos and I'm almost done with my CNA course. The clinicals are something else. Do you have any advice for the Prometric with the skills? Yes, Caleb, absolutely. And my whole program is built on Prometric. So the things you need to understand about Prometric testing is, number one, it's all about the care plan, 100%. Follow the care plan. If the care plan tells you to exercise the left shoulder, that's all you're doing. Exercise the left shoulder. Do not go above and beyond. Do not try to impress them with your range of skills. Just follow the care plan because that's what CNAs do. The minute you start bringing in anything else, you've changed the care plan, you've acted like a nurse, and now you're outside of your scope of practice. And you're going to be judged on that. So you have to follow that care plan religiously. The other thing is to focus on the patient, not you. This has nothing to do with you. But the problem is you are testing. So you're probably going to be focused on you. Oh my gosh, I have to remember the supplies. What do I need? When do I wash my hands? Did I tell the patient what I was doing? You're like all up in your own head because you're testing. And if I can get you to step outside of that and start focusing on the patient, you'll do much better because the evaluators are focused on the patient, not you. They are evaluating everything you're doing to the patient and on the patient and around the patient. And that's what they're grading you on, is what effect what you're doing is having on the patient. So if you can focus on that patient, you will do fantastic. And then just remember all of the principles that are in our program. If you don't know what I'm talking about, go to my website, look under CNA training, and watch the animated lessons. You've got to know these. If your patient is uncovered or undressed, you need a privacy blanket. If you're getting water for the patient to use, you have to check the water with the inside of your wrist, but the patient does too. They have to check the water temperature. Just because you think it's comfortable doesn't mean that they will. They don't have the same body fat under their skin that you do, because our body fat gets resorbed as we age. So that is a principle. If you're going to wear gloves, you have to know when to put them on, because the first thing your glove should touch is the patient, not your supplies and everything else. So you have to know all of the principles. So go watch. If you haven't watched them yet, go watch my animated lessons. And if you keep all of this in mind, follow the care plan, right? Focus on the patient, and the principles are going to guide your performance. If you do that, you are guaranteed to pass the state exam. Guaranteed. Okay. Good luck. Servant of Crisis. This is Yvette. I'm on a different site, but that's what I want to do. I want to work in hospice, but I'm having a hard time finding any here in my part of Florida. I'm in Northport, and I only came across one. Unfortunately, Yvette, a lot of hospices there's only one in each territory because they're nonprofits. They don't get a lot of funding, and it's very hard to have a lot of competition because you just don't have much funding. So I believe in Northport, I'm trying to remember, that's a little bit south of where I'm at. I'm not sure. I don't know if Suncoast Hospice is there. I'm not sure. But just look up Northport Hospice, or you can call your local hospital and ask them who provides hospice services in your area. But they do hire CNAs. Mashine says, as a TNA, I had my first experience with after death with a resident, and it was just as you explained. The body was so relaxed, I thought she was sleeping. Yes, absolutely. Absolutely. Mashayan says, just confusing of the care we are to give them once the resident is placed on hospice. Yeah, you're just going to provide that extra layer of care. And remember, CNAs always follow the care plan. Doesn't matter whether it's the hospice care plan for a hospice CNA or a facility care plan for the facility CNA. Just make sure you're following that care plan. Mashayan says, is hospice workers to come out daily to check on residents if they're in assisted living? Well, yes and no. So it depends on the level of care needed by that patient. This is where that care plan comes in. So as a nurse, as a hospice nurse, I would go out if I have a new admission. I go out to the assisted living facility. I look at the patient. I do a head to toe assessment. I'm looking at all real problems, all potential problems, and I'm developing a plan of how we're going to take care of this patient. So I'm going to look at the services that are already being provided to that patient, if they're adequate, and then I'm going to write up a care plan to complement that. So my care plan is going to be focused on symptom management, emotional support, family support, all of that kind of stuff. And I'm probably going to have a CNA go in there once or twice a week to give additional care, back rubs, foot massages, bathing, things that can help the patient become more comfortable. So you're going to go by your care plan that will be in addition to the facility care plan. Okay. So sometimes it'll be daily if the patient has a lot of needs. Sometimes it may only be once a week to give a bed bath because the patient's confined to bed and they're not really doing a whole lot. And they have CNAs to take care of other things in between. So it depends on the level of care already provided by the facility staff and what the patient is going to need. So there's no set number. I can't tell you, okay, every CNA is going to see every single one of their patients every single day, no matter what setting they're in, because it just doesn't work that way. It's all based on the patient. Kanisha says, hi, Miss Patty, I bought your book and I love it. Oh, thank you. I appreciate that. The 60 questions in your book, is it the same questions that on the state exam? No, it's the same type of question. Okay. So what she's talking about is in my book. Pull this up here. In my book, on page 142 is a full practice test. It is 60 questions, just like the state exam. So here they are. 60 questions, multiple choice, just like the state exam, but they are not the questions from, because that's unethical. I can't give you test questions, but it's also unrealistic because those questions change every couple of weeks. And when you go to test, there's 8 people in the testing center testing. There are 6 different versions of the CNA exam. So the questions are in different order. You may have different types of worded questions. So every test is a little bit different. It's all the same scope, but the questions, the way they're asked, or the content will have minor variations. So I can't give you the actual test, but I can give you questions that are written like those test questions. And that's what the practice test on page 142 is. Now, my students tell me all the time that my test is a little bit harder than the state test. So if they do good on my test, they pass the state test, no problem. If you don't do good on my practice test, then you probably need to study a little bit more. You can also find different questions, different practice tests on my website under CNA training practice questions. So that will kind of help you too. And they're different questions. So let's see here. Kid says, me too. Hilda says, hello, watching from the United Arab Emirates. Well, welcome. Hi, Gloria. Kenesha says, okay. And Bettina says, hi, Miss Patty. Can I know the scope of practice for CNA, please? Oh, that's a good one. This is one of my favorites, right? So scope of practice can really boil down to 5 things. Ready? We call this the 5 key principles. So what forms the base of this? And I actually just had this graphic up on my screen. I wish I had a way to show you. I don't have my banner here. But so if you think about it, you have the base of CNA. What we focus on 100% is the care plan, the whole care plan, and nothing but the care plan. That tells us what to do. That keeps us, that forms our foundation. If you go off of that care plan, if you're over here somewhere doing something the care plan didn't tell you to do, you are no longer in your scope of practice. Your foundation is always the care plan. Now, principles are going to guide performance. So you have to follow the principles when you're performing the care indicated on the care plan. So if you're going to uncover the patient, they need a privacy blanket. If you're going to get water for bathing, you check it, they check it. You know, the things we just talked about. So if you're not familiar with those principles, go watch the animated lessons. You'll become familiar with them. But that's one wall. Okay, so principles guide performance. And you can't do anything you aren't trained to do. So if you don't know how to give a bed bath, you have to tell the nurse, hey, I never did that. I don't know how. My training didn't teach me that. I need help. That nurse has to show you how. She cannot delegate anything that you don't know how to do. So that's all principles guide performance. And then you have CNAs do normal. If it's not normal, we don't do it. So if you are assigned to take vital signs on a patient, the patient has to be stable. It's got to be a vital sign you know how to take. Normal. If we've got a patient that has like crazy high blood pressure, that is not normal. That is not a task for you. That is a task for the nurse. CNAs do routine, repetitive tasks to free the nurses up I'm sorry, routine repetitive tasks on stable patients. It's a very key element to free the nurses up to do higher level tasks on unstable patients. So keep that in mind. CNAs do routine repetitive tasks on stable patients. And then while we're doing those tasks, the way the principals tell us to, according to the care plan, are you starting to see how this all goes together, right? We have to remember that we're doing this to make it all about the patient, right? The patient is above everything. So you have to tell them what you're doing. You have to get their input. You've got to make sure they're comfortable. So remember, it's always about the patient. And then as you're doing the tasks on the care plan, according to the principles, performing normal care, making it all about the patient. Anything that you notice, you're going to report to the nurse. That is the entire scope of the CNA. It makes a nice little house. The foundation is the care plan. Principals guide performance. CNAs do normal. It's all about the patient and report everything to the nurse. So it makes you a nice little house, and that's where the CNA lives. That is the scope of practice of a CNA. Anything outside of that, not your deal ever. Now, you can be trained to do other tasks. So remember, you have to be trained, and it has to be normal on a stable patient, right? So that's that whole CNAs do normal, but you can be trained to do other tasks as long as they meet those needs. And it's up to the nurse to decide what is appropriate for delegation to train you in, but you have to be trained. Training doesn't have to be in a classroom, though. Training can be at the bedside with that particular patient. Hope that helps. Denise says for the person in Northport, for hospice, you can check with Tidewell Hospice. They're in Port Charlotte and Venice. Oh, thank you, Denise. I did not know that. I'm not familiar with all of the hospice. Here in our county, we have Hernando Pasco Hospice. We also had Suncoast for a while, but then they went back down to Pasco, I believe. And then there's a Citrus County Hospice up in Citrus County as well. So there you go. Try Tidewell Hospice. Very good. You guys are all awesome. See, what a great group we have. I am really, really proud of our group. All right, guys. So here we're at the point of our conversation today where I get to congratulate those that passed the state exams. So this week we are going to congratulate Blessed Soul. Congratulations. And I'm going to try here, but Waleska Rodriguez Alexandre passed the CNA state exam. So great job. Roberta Diva also passed the test this week. Soraya Miller, I hope I said that right. Soraya Miller passed the state exam. Super proud. Tosh Mahogany also passed the test and dropped by to let us know. Pixel.1010, I like that name, passed the test and came by to let us know. And Fiona Romero also passed the test and stopped by to let us know so that we could send out our heartfelt congratulations and welcome all of these fantastic caregivers into the CNA world. So congratulations to all of you. Go out and do a fantastic job. Make sure you're always putting the patient first, and you will be a stellar CNA. So congratulations. For the rest of you guys that are getting ready to test, or if you've tested recently and didn't let us know, make sure you drop by any of my videos, leave me a comment. Don't reply to somebody else's comment. Leave me a fresh comment because those show up in my inbox. Let me know that you passed, and then I can congratulate you online as well, so we can start your career off on the right foot. So congratulations to all of you guys. And Mashane says, thanks, Miss Patty, for all the knowledge you continue to give on your channel. I viewed a lot of them, and your channel is the most informative, and you learn. Oh, thank you. That is so sweet. I love what I do, guys. I love coming in here and sharing things with you guys. And, whenever you have something you want me to talk about, leave me a comment, and I'd be happy to talk about it. Nastan says, hi, please let me know the name of your book again. I'm booked for the state exam in June, and I'm reading for it. Where will I find it? Okay, let me put this in here for you. Okay, if you go to courses.foryourcna.com/shop, or just go to my main website, foryourcna.com, and click on shop. It'll take you same place, just two different ways to get there. And the CNA Skills Study Guide is the name of my book. and it's up there. It's very, very helpful. It has all of the information on the written test as well as the skills test, step-by-step instructions. It'll get you ready for the test for sure. And pair that with all of my videos that I have on my website, and it's a complete, I mean, it'll get you where you need to go. Now you can also take an extra step, right? Because I give that stuff away. All of this stuff that I'm talking to you about, that's all free, right? Well, the book isn't, but the videos and the personality quiz and the practice test, all that's out there for free. So if I'm giving all this away for free, can you just imagine? Just imagine for a second what I have in my paid course. Just imagine, right? If I'm giving all this for free and you're finding value in it, just imagine what my course is like. So kind of keep that in mind. We have got some free lessons in there. You can take a look at the course as well. All right, guys, that is it for today. I'm so happy to be joining you. Do you have any idea what time you may want to change this to? No, Jennifer, I am completely open to suggestion, whatever works for you guys. In about 2 weeks, I think it is, I'm going to be joining you from a different place. So stay tuned. I got a surprise coming up for you in 2 weeks. I think it's 2 weeks from now. Let me just check. Hold on. Yes, 2 weeks from today, I'm going to be joining you from a special place. So, and we'll have a special lecture that day. So stay tuned for that. And Cole says, thank you, Miss Patty, for your clinical video skills. You're welcome. Marie says, hi, my name is Marie Gerard. It's a pleasure for me to watch your video. You're a big, big help for us. Oh, thank you. I appreciate it. Hi, Hilda. You're very welcome. And thank you, Denise. And I believe Denise is the one that's been asking you guys to remember to leave a thumbs up. And thank you so much for remembering to say that. I don't think about it. I'm just here to talk. But thank you guys for promoting me. I really, really appreciate it. I love spending time with you. All right. And that kind of wraps up our time. I do have something kind of interesting for you next week. So make sure you stay tuned. And we will... Oh yeah, Mashine, I know. Pearson View, oh, that's a whole different ballgame. I'll talk about that later. Yeah, it is a little bit different, but the principles are all the same. That's the one thing most people don't understand. The care plans change, the scenarios change, but the principles, they're all the same. Let's see here. Mitzalau says, I'm joining for the first time. Well, welcome. Thank you for joining. We appreciate you. All right, guys, I will see you next week. Same time, same channel, same people. Join us next week, Thursdays at 3, and I'll see you then. Until then, happy caregiving, guys. Bye.